Great. Well, welcome everybody. I see we've got a few people who've already joined and the numbers are going up. It's a huge pleasure to welcome everyone to what I'm really excited about, a conversation around gut hormones and the big O. I'm sure most of you by now have figured out what that stands for. And we're going to discuss some of these overlooked connections in women's health. I am joined by my co-founder at Pandora Health and our Chief Strategy Officer, Dr. Aja McCutchen, who is a board-certified gastroenterologist, as well as our guest today, Dr. Shenelle Wilson, who is a urologist and urogynecologist, and is also co-founder and CEO of Urology Unbound, which we'll talk a little bit more about. Great. Okay. Welcome, everybody. Just for some housekeeping rules. So we will run through an agenda where we ask both myself and Dr. McCutchen, Asia, ask Shenelle questions around her work, her approach to her work. Please jump in with questions of your own. I'll try and keep an eye on the chat. We will talk about everything from her background and why she's decided to do what she does, to current trends, to what's topical at the moment and her opinion on all of that. All of it with a gut-centric view. That's obviously what we're really interested in from a Pandora Health perspective. And then we will go into some Q&A before we end off. So without further ado, let me formally welcome Dr. Shenelle Wilson. Thank you again for being open to have this chat with us. I'm going to try and keep my intro to you brief because I'm going to ask you to talk a bit about yourself. But just for those of our attendees who don't know, Dr. Shenelle Wilson is a urologist who is based in Georgia, who provides reconstructive surgery for individuals of all backgrounds with a wide range of pelvic health concerns. She specializes in pelvic health, hormone replacement therapy across all life stages, and urinary and sexual issues, both for women and men. Dr. Wilson is fluent in both Spanish and English and takes great pride in providing exceptional patient-centered care. And we've seen this in the conversations that we've had with Dr. Wilson so far, how she really works one-on-one with individuals to address their unique holistic needs. She received the Young Urologist of the Year award from the American Urological Association since where she's been a member since 2013. And in addition to her work as a practicing urologist, Dr. Wilson has also founded Urology Unbound, which focuses on recruitment, retention, and promotion of underrepresented urologists. So really important work. And she is also the founder of the Orgasm Clinic. So a really, really busy woman with, again, lots for us to delve into. And maybe just to sort of kick off with that, given that incredible background, Shenelle, you were previously a nurse, as you'd shared with us before. And so what led you to becoming a urologist, wanting to qualify? I think in your words, it was something that you thought was boring and you would never go into before. So what led to the shift?
Yeah, definitely. And thank you so much for having me. So yes, I was a nurse first. And I remember, I tell the story all the time. I used to love the show Scrubs. And I remember on that show, when they had one of the love interests for one of the main characters, she was a female urologist. And as a nurse, I was like, that's so fake. I've never seen a female urologist. Like, why would a woman ever go into that? Fast forward to going to med school after being a nurse for about 7 years. I got into school and I was like, oh no, I don't actually know what I want to do. I've seen all these different fields, but I don't really vibe with any of them. And then I happened to have a really rough. I happened to work during the Christmas holiday, my first year of med school, in the ER, and this urologist had an awful call, but he kept on coming in for these different conditions, and I was like, wait a second, what are you? What do you do? And then he told me that urologists were surgeons of the genital urinary tract, and it just clicked. He got me onto the websites. He introduced me to the field. And I was like, this is it. This is exactly what I want to do. It vibes with how I feel about medicine and healthcare and the quality of life aspects that I prefer to focus on. And so that's what brought me into urology. Once I chose the specialty, I was convinced. I actually didn't think that I was going to end up doing female urology. A lot of times when we get into urology as trainees, we don't really know that there are a lot of treatments for women. And so there's a lot of hesitancy from even urologists in dealing with women's urinary issues. And so I found that this specialty in my third year, and I was like, oh my goodness, there are treatments. And also, I'm a woman. I may suffer for all of these later on. So let me find out about this. And, it's definitely what's vibed with me.
Any sort of moments where you had a kind of aha, this is a sort of mind shift for you in your work, where you felt, and particularly with your approach that, as you say, looks at, overall well-being, integrative health, the holistic, the whole person. Were there any moments that stuck out for you in looking at how women receive care that really sort of emphasized for you that this is the right space to be?
Yeah, definitely. I think that it's something that a lot of female physicians come to, and when we get into the healthcare space and we see that, healthcare for us is just not, it's not adequate. They don't know about women's health. We don't know about half of our population. And, we are impacted too. And so just knowing that I had done all this work to get here and that there was this big gap in our knowledge and in what was being discussed and focused on in healthcare, I was like, that's the gap that I want to fill. So it really is just from being a physician and seeing the same thing that patients see, that the community sees, that, hey, there's not enough of a focus on women's health. There's more focus on controlling women than anything else. And so I wanted to be a voice in the space that needed to be there.
We appreciate that. We appreciate that, Shenelle. I think my story is the same for those of you who don't know. So we are having an engagement with the urologist focused on women's health, and then the gastrointestinal physician focused on women's health, and both are sort of underappreciated in terms of the disease burden. So I definitely appreciate all that you do, all that you focused on, and you being just a real rare gem in the community. I was so excited when I met Shenelle. As soon as I met Shenelle, I actually reached out to Aisha to tell her about coming across. First of all, urogynecologists are like very rare. And to come across somebody that was just as passionate as we were about the women's health space, and who had been as bold in her moves in the women's health space, was just a truly a blessing. And I have to thank our mutual friend, Dr. Barbara Joy, that also runs a women's clinic here in Atlanta called The Healthy Woman, that has multiple locations for that. So shout out to Barbara Joy for that introduction. I just had to jump in there, Aisha. I'm going to turn it back over to you.
Cool, great. And I know we'll have in a few minutes the opportunity for me to ask both of you questions, and we'll talk about the link between urology, gut health, hormonal health. But I wanted to also just ask Shenelle about the Orgasm Clinic, which again, we'll go a bit more into later on in the talk. But it seems like quite a bold move to start an orgasm clinic called the Orgasm Clinic. And so, what was behind that? And what was the origin story?
Well, it's very much the sex medicine part of my practice. I've had my solo practice, Metro Atlanta Urology and Pelvic Health Center, for 3 years, which is aptly named. I focus on pelvic health medicine. It doesn't yell sex the way I needed it to, because really I want it to be very obvious. This is what I do. This is what you're going to get when you come here. I want to remove those barriers that really stand in the way of people getting help. And it's really, they don't want to talk about it with their doctor. They're embarrassed to talk about it. They don't even know that it's something they can bring up with their doctor. So the Orgasm Clinic takes all of that away. You know where you're coming from. I know where we're coming for. This is what we're going to talk about a lot.
Awesome. Great. And then, yeah, I mean, let's jump into the links between, urinary health, pelvic health, gut health, sexual health. And so now I'm going to ask both of you about some of these, these connections. And so, Aisha, you've given a bit of an introduction to yourself, but also just to say that, our co-founder, Dr. Aja McCutchen, is also a powerhouse, women's health expert and advocate, not just as a gastroenterologist, but as someone who, from a Pandora Health perspective, and when we talk about whole woman care, has been someone who really is an example of that in the way that she treats her patients and practices medicine. And so, when we talk about these things, I think what will come across is that with both of you, you talk across specializations. And again, I just think it really speaks to both of your approach. And so maybe, for people who are joining the call and might not know as much about these links, maybe they've been to see a urologist or their GYN, or they've had a GI issue and gone to, a gastroenterologist, but they haven't sort of seen the connection that some of these issues and conditions may have with each other. So maybe I'll ask you first, Aja, how is gut health connected to urinary health? If someone, for example, and maybe just to use an example, has, bladder problems and is experiencing incontinence, how could that be related to gut health?
Yeah. So that's a loaded question, Aisha. And I do have to shout out my entire Pandora Health team. I'm not just a powerhouse alone. We are all powerhouses. And we're so grateful and thankful to be working together, and thankful for all of you for joining us tonight. I don't know why I can't get my words out tonight. So here's the deal. The way that I think about this, and Shenelle, please feel free to jump in, is that the gut and the reproductive system, they're neighbors. They are neighbors, and they're not just neighbors. They're like a duplex. They're sitting in the exact same space, in that pelvic space. So when you have a problem in one compartment or one organ, such as the bladder, it can affect the neighbor, because it's a duplex and they are definitely connected. The other thing is that the hormones that are produced, in the body in a female, for example, estrogen, is also heavily influenced by the gut. And that affects things such as the bladder's environment. So while we think of things like urinary tract infection as just, some organism keeps getting in, the truth is that the environment is a setup for these organisms to sort of, overgrow and overpopulate. It's not necessarily that the organisms themselves are bad. It's that we have this sort of opportunistic space that is probably suboptimal in some way, that is allowing these things to happen. And so, and the woman is different than the man, in that the woman has even a different shaped pelvis. Our pelvis is round. It's called a gynecoid pelvis. And we're very, we're made to reproduce, right? So this pelvis is made to expand this way. But what happens is it doesn't necessarily accommodate as well for some of the downward pressure that can occur. And that leads to a weakening of the pelvic floor. And again, because those organs share the same little compartment, both systems are going to be affected. And so that is really sort of the direct way that the gut health is connected to the bladder health. And we see some pretty serious conditions associated with this. So for example, many of you may have heard of diverticulosis. Those are pockets in the colon. I tell my patients, these are like potholes in a road well traveled. So most of us will get these over time. But if you get an infection in one of those pockets, for example, and you get inflammation in the colon because it's right next to the bladder, you can actually have stool to come into the bladder through an abnormal connection, which is called a colovesicular fistula. And so people will describe like, I'm having bubbles, like there's air in my urine. And so it's just incredible when you think about the proximity of these organs, and that we have not focused on the woman and all that this sort of means down the line for her as it relates to the two.
Absolutely. And you know, when I talk to my patients about pelvic health, I tell them to think about their pelvis like a bony bowl lined with muscles with a lot of things stuffed into it and coming out of a tiny hole. I mean, really all of our holes down there are in a very, very close proximity. And there's a lot of organ systems that are trying to get things out and also accommodating things in. And so when you think about the gut, a condition that I manage a lot is constipation. Because I'm like, if your sigmoid colon, which is down there, smushed into a very small space, is full of stool, and your bladder is also down there, your bladder can't fill. Then you're going to have overactive bladder. You're going to have overflow incontinence. You're going to have all these other urinary issues because your bladder just can't full. You're also your nerves, your pelvic nerves are trying to get you to expel that stool. So those are the same nerves that are innervating the bladder. So overactivity there is going to result in overactivity in the bladder. So that's a really close way that it's impacted. Also, constipation, gut issues are going to affect the microbiome. We have bacteria all over our body. We're supposed to be in homeostasis. We're supposed to be a balanced area where the bacteria work together to promote our health. But when we get constipated, when we have gut health issues, we get overgrowth of certain bacteria, it changes the pH, it can change our vaginal pH, and then we have a lot of additional issues. So gut health is extremely related to genital urinary symptoms.
Yeah. And you made some great points there too. I mean, when you have constipation, that puts direct pressure on the bladder. It is, so people that feel this pressure down there, like this sense of fullness, they're uncomfortable, they're not crazy. You're not crazy to feel that, because that's exactly what's happening.
Oh yeah. I see a lot of pelvic pain, and at least a quarter of the time it's constipation. I mean,
yeah, I remember you saying that.
It really is constipation.
And that you'll do a pelvic ultrasound, and right there you see the stool burden.
Or just put my hands inside.
GI problem.
Put my fingers inside. I'm like, yep, I can feel a bunch of poop there.
Yeah.
Thanks, both of you. And I think, you mentioned some important things around the interconnectedness of the different organs, and, squeezing multiple sort of organs and systems into a very small space. Your uterus, your intestines, your bladder. And so, in thinking about different things that women may encounter in your life and the impact that they might have further down the line that you might not directly attribute to symptoms that you're having, what are some of the things that commonly show up that women have to watch out for?
Shenelle, do you want to take that?
Yeah. So in terms of your urinary health and your sexual health, of course, down the line, your hormones. So as we age, we may have a lot of different hormone issues. When we're younger, people can experience PCOS, which is an endocrine issue. There's also a lot of women who are on birth control, so we're causing a lot of endocrine and hormonal imbalance by way of preventing pregnancy. Then we get to perimenopause, which starts in our mid-30s for a lot of women and sometimes earlier. And we really haven't recognized that up until really recently. And so, your microbiome can start to change. You start to get a decrease in progesterone and testosterone, and that's going to impact your pelvic health, your sexual health, and your hormonal health. And of course, then there's menopause. So that the drop of all of these hormones can result in genital urinary syndrome of menopause, or GSM, vaginal atrophy. I talk to every woman about that, where we don't have enough estrogen getting to our vaginal tissues, and they become weaker, they become thinner. We become more susceptible to getting UTIs. So we all know about how women start to get UTIs when they get to a certain age, and we have a very, very good way of preventing it that most women are not on. And so vaginal estrogen can really help that. It can also help to prevent overactive bladder and vaginal dryness, which of course can result in painful intercourse. So a lot of these issues are just really interconnected, and they occur to the vast majority of women, and we just don't talk about it enough.
Yeah, I think you made some great points there. One of the things that happens around that perimenopausal time is that you get this imbalance in the progesterone and the estrogen. And so the progesterone is going to drop first, and you have this period of time where your estrogen levels are just somewhat erratic. And as a result, our behavior is erratic, but it also affects our microbiome as well. So that estrogen dominance is what it's called, affects our microbiome. And there are certain species of bacteria that may be more pathogenic and thrive in this estrogen dominant environment. And so I often have women come to me and they're like, you know what? I don't know what's happened. Everything I eat, I look like I'm 9 months pregnant. I don't know if they come to you with that.
Oh yeah, the bloating is out of control.
The bloating is out of control. The bloating, I would say, the brain fog and the mood swings are the 3 most common complaints that that I get from women on the GI side that are suffering from this. And in our patients that already have like irritable bowel syndrome diagnosis, where they suffer from alternating bowel habits with abdominal discomfort that's relieved with bowel movement, and these instances when their hormones are shifting, you really can get an exacerbation or a worsening of those symptoms. And I think their pelvic floor, as you alluded to, is also impacted. And this is where, they're in their 30s and 40s. They may have had kids around this time. They're trying to jump on the trampoline, and they are either sharding or, having urinary incontinence. And that is because the estrogen levels are changing, and you're no longer getting that full support that you need of the lining of your pelvic organs, which are again shared by both your gut as well as your reproductive organs. So very good points there. I just wanted to underscore.
Yeah, it's important to remember where the receptors for progesterone are. So they're in the brain, and then they're in our reproductive organs. And so that's where we're starting to get this brain fog. We're having issues sleeping or falling asleep, staying asleep. Of course, the bloating we've already talked about. You can also start to get a lot of insulin resistance and issues with that, because progesterone and all of our sex hormones are really important when it comes to our metabolic function. And so, we see these conditions that happen in women of a certain age, and it's really important for us to start as providers, and then of course as women who are becoming more informed about our health, really bringing up hormonal health to our own providers to make sure that we're staying in balance so we don't get these conditions.
Yeah, one of the things that I wanted to ask you, Shenelle, is in our world, a lot of women would come and they would try various probiotics. And I know in the GYN space, there is a very clear and established role for probiotics. I want to remind people the gut is super complex. It's 25 to 30 feet long. And so probiotics may not always be as clear-cut and helpful in the GI tract as they are in, say, urinary and vaginal conditions. But can you just sort of speak to the effectiveness of probiotics in the GYN and sort of urology space? I think that would be helpful.
Absolutely. There are quite a few women, and it doesn't, work for everybody, but quite a few women who are getting recurrent urinary tract infections, recurrent yeast infections, bacterial vaginosis, in addition to treating people with antibiotics, which we try to stay away from, right? Because we really need to be stewards of the antibiotics. We're not really making any new ones, and we have a long life to live, so we don't want to use antibiotics too frequently. So there is a role for using probiotics, putting them directly into the vagina. I get patients onto those as long as they have like a gelatin capsule. I know that they're going to dissolve, and we can start to get those lactobacillus species really directly into the vagina to help change that microbiome. Most of the times when I'm dealing with patients with these issues, I'm also helping them to change their diet. So getting in more vitamin D, getting in more fiber, getting in more natural prebiotics like kimchi and sauerkraut, because even though probiotics may not specifically change the flora, helping the gut to function better will really help the genital urinary tract as well.
Yeah. And I think just speaking of functioning better, people with constipation, they are at increased risk of bacterial overgrowth. And so just in terms of our audience on here, what is normal, what's not normal, how do we define constipation? Constipation is where you have, straining with bowel movements, you're uncomfortable, or you have less than 3 bowel movements per week. So there is a normal range. There's a bell curve for what normal bowel movement looks like. And so that can be anywhere from 3 times per day, according to traditional medicine, up to down to as little as 3 times per week. And when we get to, women having less than that, we do worry about bacteria translocation. I used to tell my patients for every gram of stool, there's a billion bacteria. So we've got a ton of bacteria there. And when you have that heavy stool burden, you're going to affect the neighbor nearby, because that bladder gut sort of two-way connection is definitely going to be impacted there. So we definitely want to keep the ball rolling. And there may be some probiotics that may be helpful there. We are shifting in the gastroenterology space because of the complexity of the gut to really encouraging people to take foods that are high in probiotics. So that's going to be like your fermented foods, kimchi, kombucha, your yogurts, things that naturally have the lactobacillus, and you don't know what these, I guess, shelved items really contain anyway. And then really going upstream from that with prebiotics. So that's going to be the fiber that you mentioned. That's going to be, your foods that are high in pectin, like apples and potatoes. You have to cook them and then cool them. So there's, some nuances around how food is prepared as well, which we won't get into. But really nourishing that gut, I think, will help everything. But the vaginal probiotics, I just wanted to bring that up because there is clear benefit because you have a short space that you're working in. And I know lactobacillus is, predominant there. And in our women that are perimenopausal and postmenopausal, that lactobacillus goes down because of the estrogen, which is influenced by something called the estrobolome. And the estrobolome is the estrogen that is produced to certain forms by your gut bacteria. So all of these things are intertwined and interconnected.
Absolutely. One thing that I tell patients a lot when I start them on hormones or we start that hormone discussion is to remind them that the gut and the GI tract is not just for digestion. It's an endocrine organ. It's the biggest endocrine organ that we have. Our estrogen is metabolized in there. And so, you cannot have normal hormonal function if your gut is not working correctly. So it's very important, and it's part of every discussion that I have with any patient, man or woman, who is coming in for hormonal replacement therapy.
Yeah. And then Aisha, I think you see one of our participants was asking about, okay, I'll turn it over to you.
Yes. I think such great points and love how both of you have spoken about nutrition and lifestyle and preventative measures, as opposed to, dealing with issues later down the line with purely sort of medicinal remedies. And so one of the questions that have come up is actually from Dr. Latha Alaparthi, who's one of our co-founders at Pandora Health. And Latha's asked, can you comment on childbirth trauma and its downstream effects and ways to prevent them? And I will, whichever one of you would like to go first. I'd love to hear from both of you.
Well, I will give what I'm able to, but I will also start by reminding everybody that I'm a urologist. I know the urogynecologist, gynecology part sometimes throws people, but I don't have anything to do very specifically with childbirth. However, as a urogynecologist, I do end up dealing with a lot of people who are suffering from 3rd and 4th degree perineal lacerations that occurred during traumatic childbirth, as well as pelvic organ prolapse that can happen after childbirth, especially if it does not resolve by itself. And so those two things very specifically, as well as fistulas. We talked about covesical fistulas earlier with diverticulitis and that abnormal connection between the colon and the bladder. But also during childbirth, you can get what's called a rectovaginal fistula, where the rectum and the vagina, due to either injury because of the traumatic childbirth, too much pressure due to a prolonged childbirth, you can get an abnormal connection between the rectum and the vagina, and then get that fistula. So though that's kind of where I tend to come in. Now, a lot of those things, those are in terms of trauma during childbirth, fistulas during childbirth. If that happens, that just has to be fixed. But in terms of the pelvic floor, there's definitely a lot of things that can be done conservatively. Most of my patients, when I get them, if they are prenatal or they're pregnant at that time, I will get them involved with pelvic floor physical therapy pretty early. And absolutely, as soon as they deliver and they're up to it, I get them back onto pelvic floor physical therapy, because pregnancy is a time where we can get into a lot of dysfunctional voiding. You can get a lot of laxity of those pelvic floor muscles, get weakness, get leaking, incontinence, pelvic pain. So just trying to nip a lot of those things in the bud and reverse them as soon as possible. So I definitely encourage patients to get pelvic PT in and around childbirth.
I think that's wonderful. That is one of the areas that we're definitely focused on with Pandora Health, is making sure that we proactively manage and prevent some of these issues. So much of medicine is reactive. And I think it's, kudos to everybody that's on here, because we can be proactive. If you know that you are about to have a baby, let's start strengthening that pelvic floor ahead of time. So what we see on the GI side of this is first of all, we're very cognizant, especially the women that are working with Pandora, about asking women about their childbirth history. Did you have a C-section? How big was your baby? Did you have an episiotomy? Do you know what degree of that you had, if there was a cut involved? Because we know that long term, there's a couple issues that can occur on our side. One is, because of all of the extra volume in pregnancy, for example, women get hemorrhoids. Hemorrhoids are veins that are, typically there in most of us. We have 3 columns, and most of the time they don't cause a problem. But oh boy, you will definitely know when they do cause a problem, because it is super painful. There's thousands of nerves in the innervating that anal rectal area. And Shenelle, correct me if I'm wrong, I think it's the same or similar to the glans penis, where you have like 30,000 nerve endings there. So when there is, pain in that area, it is extremely painful, and women will often complain about hemorrhoids. And then later down the line, they'll come and they'll say, I've had hemorrhoids since my child was born. And I'm like, well, how old is the child? He's 25. Okay, so for 25 years, you've been suffering with these hemorrhoids. And that's just how taboo the topic was. But this dates all the way back to when they were pregnant. So that's one of the ways that we can kind of get ahead of this. Is we want women to take that fiber. We don't want you to strain. We don't want you already have a baby in there. So having all of that downward pelvic pressure, that's not really, a good situation for your pelvic floor. Your pelvic floor will eventually get weak. And as we talked about, over time, anyway, we have gravity, we have hormones that are shifting, and that's going to impact it. But the other thing is, when the woman did have her episiotomy or whatever happened during her childbirth, did that potentially impact her rectal muscles, her anal rectal area? And, we have a lot of women that are walking around with incontinence and don't talk about it. They're not able to hold it at times because there is an actual tear in the muscle that can be undiagnosed. So I love the proactive nature, but also, if you do have any of these symptoms, you don't have to live with them, and you should seek care because we do have a lot of treatment options, including muscle repair. So I will stop there and turn it back over to you, Aisha, because I can go on and on.
And Asma Kapra, Dr. Asma Kapra, another one of our co-founders, also has just made the point that physical therapy, specifically for your pelvic floor, is so important. And she says in Europe, all women get immediate pelvic floor therapy after childbirth, which I think is just such a great practice and such a great way to take care of women postpartum. We had two questions about supplements and vitamins. So obviously top of mind for a lot of people, which is great. And so I wanted to, again, ask both of you and maybe Shenelle, just to start with you again and then ask you, Aisha. But so we had two questions about daily supplements that you recommend, both for gut and uro health. And then also specifically, Sparkle Webster was asking about maca root, vitamin D3, vitamin K, and then various magnesium supplements.
So vitamin D, absolutely, absolutely, absolutely. Vitamin D deficiency, it's a big driver of uterine fibroids. It's a big driver of a lot of conditions, a lot of inflammatory conditions of the reproductive system. It is needed for hormone metabolism. So vitamin D is one of the first things I'm getting people on. I'm screening everybody who comes through my door for low vitamin D. And I don't care if it's 35 and it's within normal. I need it to be 80 to 100, somewhere there. So if it's not in the 60s and heading that way, I'm more than likely going to start supplementing you with, vitamin D2 high dose, as well as getting you onto daily vitamin D3. DIM is another supplement that I get a lot of people onto with hormone metabolism. It's really important for estrogen metabolism, progesterone metabolism. So I definitely get a lot of people onto that supplement. And this is men and women. This is all of us, because we all make these hormones and we all need these hormones. What else do I get people onto? I always check B12 because I deal with, the people are coming in for fatigue that comes along. And most of the time when they're coming in to see me, we're in our 30s and 40s and 50s and 60s. So we've been living, those of us who are here in the States, we've been living in a very toxic environment for a very long time. So a lot of what we do is nutrition work, knowing that all these things need to be good. All these underlying foundational things need to be there for you to feel your best.
Yeah. And I would echo a lot of what Shenelle has already said. The people coming to me, they are experiencing some complaints of some sort, of which fatigue is definitely an overlooked patient related outcome. And we have a keen focus on asking questions around sort of people's daily lives and symptoms. And so similar to Shenelle, I make sure that they're not vitamin D deficient. In our patients that already have inflammation or autoimmune disease, it can really kick people into a big flare up. There was a mention of magnesium. We like magnesium. It's very helpful for kind of relaxing nerve endings. It helps, with motility in the gut, just acting to pull the water down with it. And it tends to be, unless you have some kidney issues, fairly safe and effective as a supplement. So magnesium is a supplement that, unless somebody has some other comorbid conditions where I feel like they're not going to handle that extra magnesium appropriately, we do sometimes recommend it. It's not universally recommended to everybody. And then you made a great point around B12 supplementation if you are deficient. If you're not deficient, the water soluble vitamins, even if you're taking all these vitamins, you're just going to pee them out. So the body is marvelously made, and it tends to get rid of the things that you don't need. And then there was a question around maca root, which, maca is very high in fiber, which improves your microbial diversity. We know that diversity seems to be key in terms of you living a long life and having decreased disease burden. So I don't necessarily recommend this in a supplement form. It is best to eat your foods, because we don't know what is really contained in the bottles. It's not regulated by the FDA. So things that are unregulated can be a little bit unwieldy and inconsistent in terms of the actual dose and effectiveness of the therapies that you're getting. And that is the main problem with supplements. Some supplements are helpful. There are some sort of standardized labs that are supposed to be more credible, but they're not all created equal. And that's why we don't just routinely throw these supplements at people. We like to have an objective measure of a lab, and then we like to be able to replete what you're deficient in a reliable way and in a safe and effective way.
And Aisha, I know we've got to move on from supplements. So just a quick answer to this question that Jasmine's asking, gummies as opposed to pills, and then we'll move on and touch on some different subjects.
You know, I don't have the exact answer as to gummies versus pills, but I would think that powders, just because of the easy absorption, something that you can mix in water, is very effective. Gummies, I worry about the concentration of the magnesium in that gummy and what else is in there. You've got some gel that needs to hold it together, probably some emulsifiers, some sugar. So you may have some other interactions that you don't anticipate versus just trying to be a little bit more pure, perhaps in a pill form. But that is not by any means a validated answer. That's an educated guess. Shenelle, do you have?
Absolutely. I was about to get on here and say the same thing. I'm like, look, I don't like supplements or healthy things that are masked to be like candy or soda. Like, I know they have this probiotic soda. I'm like, no, like, I mean, I'm not going to recommend it. You can try it. Maybe it's fine, but I'm just going to go with probably not.
Yeah.
I don't trust it personally.
Yeah, I agree.
Yeah.
Great. Thank you. So I want to shift over and talk about sexual health, and I'm also going to hand over to Aisha to ask some questions in this vein. But maybe just to kick us off, I'd love to talk about your approach to sexual health, to pleasure, to intersectionality, and how that all of these sort of more modern notions tie into your way of practicing medicine and your approach. And then I'm going to hand over to Aisha to continue the questions.
Absolutely. Well, what I tell everybody is, I mean, I don't understand why sex is such a taboo. Like, the vast majority of us got here through sex. The vast majority of us are going to have sex. You know, it's natural to consenting adults or more, as long as they're consenting adults. Like, it's, you know, it's sex. It's fine. We all do it. And so, I mean, sex is, in my practice, is definitely foremost and forefront. Every person who comes into my practice is gonna get screened about sex. So I have some sexual health questionnaires. And so that just kind of gets them used to the conversation. And then, you know, I come out and ask them, I talk to them about sex. I ask them if they're having sex, if they're enjoying sex, if they're having any issues with sex, like anywhere. When I'm evaluating, you know, people with a sexual condition, I'm looking at a few different areas. I'm looking at desire. I'm looking at arousal. I'm looking at the actual orgasm. I'm looking at pain. And then like miscellaneous things, like a lot of times embarrassment and trauma. So the things that can impact that, you know, with arousal, that's going to be blood flow. I always tell people sexual health is like the perfect barometer for your overall health. Everything, like your hormones, your gut, your cardiovascular, everything needs to be intact for you to have an optimal sex life. And so when I'm dealing with people who are not having, as they're like, yeah, I'm turned on my partner, but like, I just, you know, I'm not really feeling it down there. You know, I'm thinking about blood flow issues. What do we need to do to increase your blood flow? If there's a desire issue, then I'm thinking hormones. I'm thinking, you know, what is possibly going on socially? You talk about trauma, and there's too many patients where I'm the first person they've ever told that they were sexually assaulted, which is, you know, to me, a travesty. All physicians should be asking about that. But, you know, definitely talking about, you know, what's going on with those desire issues, and if there's something organic behind it. Absolutely pain. So when we look at how menopause, perimenopause, lactation, the times where we have hypoestrogen states and our vaginal tissues become thin and atrophic, then we start getting vaginal dryness, that can lead to pain. Constipation and gut issues, that can lead to pain. Hypertonic pelvic floor. I mean, so we are all stressed and we are clenching you're clenching. And so a lot of people are holding all this stress in their pelvis. And so that can lead to pain. So, a lot of conversation about pain, if that's what's going on, and trying to figure out how we can get rid of that. The miscellaneous things. So if there's embarrassment because of leaking, or if there's embarrassment because there's pelvic organ prolapse, then that's kind of where I'll go. So there's a few different kind of categories that I'm going to be approaching as I talk to my patients about sex, to really be able to narrow down where those are, so we can come up with a treatment plan to address all of them.
Yeah, I really appreciate that. And I love how you broke that down into various categories, because with that nuanced breakdown, you can more accurately address what the underlying challenges may be with that person. And then you hit on something that is super important, which is trauma-informed care. We should all practice in a way that is based on trauma-informed care, where we're asking people about their past, and because the past definitely influences the present, and there may be some issues in the past that are interfering with their ability to even think about having sex, or they may have some fears around it. So I really appreciate that. And then on our end, you mentioned, they may have some other diseases. For example, in our patients that have inflammatory bowel disease, which is Crohn's disease and ulcerative colitis, if they have surgery and they have a bag, sometimes they're afraid to tell their partners that they have this bag. And you'd be surprised by the number of people that are in relationships that are afraid to pull up their shirt and alone. And let's not even talk about having sex. Okay. So that's not even in the realm of possibility for them. So opening up Pandora's box with Pandora Health to talk about these things is of utmost importance. And this will significantly improve the quality of life of not only women, but also men. And it doesn't matter what the orientation of the relationship is. You can be in a lavender marriage, who cares? But this is what's important. Like you said, we all got here most of us by this natural act. And so it is one of the pleasures in life that I think we should definitely talk about behind closed doors, and people should feel comfortable exchanging that information.
Absolutely. It doesn't go away when you get older. Like, I mean, the amount of 50 and 60-year-olds were like, well, I'm kind of done. And I'm like, if you want to be, that's perfectly fine.
Right.
I don't.
Yeah. No, you should never. It's not over till it's
but
over.
It doesn't have to be over. Like, you don't have to just accept it, especially if it's important to you.
Yeah, agree. And we know, like, now, even in nursing homes, nursing homes historically have had a higher rate of STDs back in the day, because that sexual desire does not necessarily go away.
Yeah. I've put an implant in a 92-year-old before.
That's right. It's an STI now. So let's talk, Shenelle, about the orgasm gap. We are all about, health equity these days, and there's a lot of focus on closing these gaps and disparities in healthcare. And I spend a lot of time with organizations that are focused just on closing those gaps. The orgasm gap is real, okay?
Absolutely.
And so I want to know, like, why do you think there is an orgasm gap, and what are some of the biggest misconceptions that you encounter in your clinic?
There is an orgasm gap because women are perfectly fine. Well, a lot of us are having sex for different reasons. And a lot of women are not having sex necessarily for the orgasm. It's for the closeness. It's for that intimacy. It's for a lot of different reasons, but it's not necessarily for the orgasm, where I think for a lot of men who are coming into sex, unless we're trying to do this for fertility, where a lot of times they're coming in there for the orgasm. That's what they intend to get out of it. And so, that's part of the reason. Another reason is that, women, we're not taught about our orgasms. Like, that's never really, even in sex ed, when we're younger, we're taught about preventing pregnancy and, STIs and how to use a condom, and even the more progressive ones, but no one's talking about pleasure for women and like normalizing it.
Mm-hmm.
little children masturbate, little girls masturbate at 2 and 3 years old. And I've seen moms like, getting embarrassed or like, what should I do? Because my daughter is playing with herself. She's supposed to, that's her body. That's a little pleasure box. Leave her alone. So, it's a lot of things. And I mean, a lot of it's societal, but the truth is, we oftentimes deprioritize ourselves. We deprioritize our pleasure. We compromise on our pleasure. We compromise on a lot of things. And we also don't know that sex is necessarily supposed to be pleasurable for us. Mm-hmm. And so I think that all of these mindsets and all of these societal things play into this orgasm gap.
How do we begin to normalize those conversations then? Do you think, for example, that every specialist should start to have a conversation around, asking women, are you having orgasms? What percentage? Is there a certain percentage of the time that we should have an orgasm, for example?
It's not so much a percentage of the time. It's knowing how you have an orgasm. I think most women don't know how that not most, but a lot of women don't know how they get an orgasm. And then a lot of men don't know how they get an orgasm. Most women do not orgasm with just penetration alone. That's what all of the pornography shows, all the TV shows. This is just bang, 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 bang. And I remember I had a patient once, a guy, and he was in a position where, and I asked him permission to show him, but I pushed on his perineum. I was like, what does this feel like to you? He was like, it's a little annoying. I'm like, that's where the vagina is. Like, there's our glands, and our clitoris is like, that is analogous to your glands. And most of you are not going to have an orgasm unless your glands and your shaft is stimulated. So if you're ignoring our glands and our shaft, then it's a good chance that we're not going to have an orgasm. So it's not knowing how to orgasm with a person with penetration, and it's a big lack of knowledge. At the end of the day, it's a big lack of knowledge.
And from an anatomy standpoint, I love how you made that analogy that, essentially these are like the glands for the woman. And so what do you want women to know about their anatomy as it relates to sexual health?
I ask almost every woman who comes in to see me for any sexual anything, or if I just uncover it because I've been asking them, I ask them to start to masturbate. We talk about masturbation and the different things that they can do. A lot of people think it's just vibration. I talk to them about, there's the suction, there's tapping. We talk about the different ways, and I assign them, go home and figure out like what feels good, and do it by yourself. The best way to empower yourself is to know what you like, so that when you are now with a partner, you can instruct them on what to do. I also encourage women, because we know that clitoral stimulation is really necessary for a large amount of women to have an orgasm, to start using toys during intercourse, like not before, not after. Well, before and after are fine too, but during penetration, there's no special or right way to use a sex toy. And so really getting them to start feeling comfortable with bringing in, additional members of the team. And making sure that they know that, it's not going to desensitize them, get their partners involved so they know this is your teammate. This is not your competition.
Right.
This is going to make you get more of what you want. So start to use it. And really just learning more about themselves.
That's perfect. I cannot believe this. We only have 3 minutes left. I want to make sure there's a question from one of our members of the audience. What are some of your suggestions, Dr. Wilson, for managing issues in postmenopausal women? Since I've missed the HRT window at 64, is estradiol cream my only option?
No, I started my 67-year-old mother on hormone replacement therapy. I don't know where this special age came where we decided women get to stop being healthy at 65. You can have hormone replacement therapy. I started an 80-year-old woman on it a year ago, and then she came in this past year and she was like, I've lost 10 pounds and I've done nothing differently. I'm like, yes, we're balancing your nutrition and your hormones, and you were always doing the same things that were keeping you healthy. It's just that you didn't have the support. So I'd love to like dispel those myths. There is no age limit to hormones. Definitely with vaginal health, vaginal estrogen is so important. You can also, testosterone is also really important for a lot of women's libido. Managing, getting the estradiol and the progesterone, because really it's the balance of the three hormones that really optimize things. And once we get the hormones in check, we get the vitamins in check, we get the nutrition right, then we see if there's anything else left over. And then there's a lot of other supplements that we can use if those aren't enough. But definitely 64, get yourself some hormones.
Yes. And there's a question about the risk. I want to get into our rapid fire questions before we get to the end, but there's lots of questions. You guys have to make an appointment with Dr. Wilson. She is available. Do you do telehealth as well?
I do telehealth, and I have quite a few states that I have telehealth appointments with.
Yes. So it sounds like you need telehealth. Does it cause cancer? Was another big question. Just a quick yes or no.
Estradiol, no. Bioidentical estradiol does not cause cancer.
Perfect. Let's get into our rapid fire. Aisha, can I rapid fire her since we have 1 minute left?
Maybe one or two rapid fire if you just want to ask about trends with like a quick yes or no answer. And then I want to end off with asking the two of you a closing question. And then I think let's close. But it's awesome to see all the activity. The numbers were going up as we were talking about sexual health. Like their friends and going like, jump onto the call. This is great. So maybe I would love to have a follow-up where we're able to just dedicate a bit more time to the subject. But Aisha, go ahead.
Okay, perfect. Shenelle, vaginal steaming, yes or no? Is it a trend? It's a trend.
It's a trend. I don't know that it works. I tell people, do the things that we know you need to do, like vaginal estrogen, make sure you do your probiotics if you need those. And then if it doesn't hurt you, then that's fine. I don't think regular steam is going to hurt anything. But, what I would imagine that it does is it increases blood flow.
Okay. What about apple cider vinegar baths?
For the vagina? Mm-hmm. I would not.
Okay. Boric acid suppositories.
There are a lot of people who use those because basically it helps decrease some of those bacterial loads with bacterial vaginosis and things like that. The biggest issue I have with those is that everybody is not having the same issue. And so just using this treatment to deal with your vaginal issue, I just don't like that because you may not be having the same vaginal issue your friend has. So I always recommend getting evaluated instead of going to self-treatment.
Yeah, maybe may mask something else. That's a great point.
Yes.
What about lasers for vaginal tightening, lubrication improvement, and postmenopausal and postpartum rejuvenation? Are they helpful?
Yeah, so there is definitely research on the use of laser treatment. There are, of course, there's a few risks, but they're pretty low. These, again, work by increasing blood flow, increasing the growth of blood vessels, and that helps to bring rejuvenating factors into the vagina. So it definitely works. Nothing to me works as good as vaginal estrogen. So that would be my baseline, but there are definitely things I do on top of that for people who need a bit more.
Okay, and have you heard of yoni pearls?
I have.
Okay, what do you think about those?
I don't really know that much about them, to be honest. Like I have different people, honestly, because I hear different things. And so I don't think that they're standardized. So that's also really difficult when I'm talking with people because what you're describing is not what everybody else is necessarily describing. So then it's like, well, I don't want to say, yes, this is fine if I don't know what you're specifically talking about.
Okay, and the last one that everybody wants to know about is the O shot, the orgasm shot.
Oh yeah, well, I do that at the Orgasm Clinic, and I have had it done myself. It is delightful. So it's PRP, it's platelet-rich plasma. We use that for hair, we use that in joints, we use that all over the body. It's basically using the rejuvenative factors in your blood and your plasma all these growth factors and help things that help with, again, blood flow and blood vessel growth that I inject directly into the clitoris and G-spot. And so just based on my personal experience, it's delightful. People who've never had an orgasm, it's not necessarily gonna bring an orgasm that's never been there. There could be something else going on, but it's gonna increase the clitoral volume and definitely get a lot of blood flow into those areas.
Awesome. Okay, Aisha, everybody's asking me for Dr. Wilson's information, so just please drop your information here in the chat so that our participants can know where to find you. And then I'm going to turn it.
I am here in Georgia.
Yes, yes. I'm going to turn it back over to our CEO, Aisha Pandor.
Yes, and Shenelle, while you're sending your info into the chat, I'm going to just ask you then to go first, Asia, with a piece of advice. I've seen a lot of women asking about how to receive holistic care, how to bring up some of these questions and issues with their healthcare providers. So maybe if just off the back of this conversation, some of the things that we touched on, what would one key piece of advice be that you would give to women who want to be able to talk more about these things? Asia first, and then Shenelle, and then we'll wrap up.
Yeah, I would say first, that's why we created Pandora Pandora Health is designed to have open conversations and support you throughout your hormonal journey so that you are equipped to have these conversations both before and after your visits. That's the first thing that I'll say. And secondly, I want women to feel empowered and prepared when they go in for their doctor's visits. I want you to feel comfortable asking these questions. And if the provider or physician is too rushed, then that's not the person for you. This is your real life. You have one time around this mulberry bush. So we have to make it count. And when you walk out that door, you are the one that has to live with whatever you're suffering from. So it's important to prepare and see if you can get the answers that you're seeking.
Absolutely. Absolutely. I mean, the key is we know that there's gaslighting in medicine. We're gaslit ourselves from our providers sometimes. And so I tell patients, just like you said, you are your biggest advocate. You have to advocate for yourself. You're the only one who's going to do it. If your provider is not giving you that report, then find someone else. You have the decision and choice for where you're going to spend your money and your time, and this is your life. So do the research and try to find, if you know that you're interested in hormonal replacement therapy, most doctors are not necessarily doing that. So see if you can find that person, do that search ahead of time, call ahead of time before, wasting your time. Find somebody who believes in natural care and bioidentical hormones if you're interested in that.
Yes.
Awesome. Love it, love it, love it. Thank you both so much. I'm just going to end off with a comment that Sparkle Webster made, which I think is so important and probably resonates with a lot of people on the call. Why are some OBGYNs, but this is, I guess, providers reluctant on educating or being more open about women's health when it comes to the topics that you're speaking of? A lot of the things that you are all speaking of, I'm just learning about. And that is why we exist as Pandora Health. That is why we invite brilliant healthcare providers to come and talk during these webinars, to be part of our community. So I think it's just testament to why we exist and why we hold these webinars. So thank you again, Dr. Shenelle Wilson. Thank you, Asia, for organizing this. The questions and activity, I think, is proof of how important these conversations are. So thank you both so much for the session, but also just the work that you do in supporting women.
Absolutely.
Yeah. And thank you, ladies, for all putting yourselves first and joining us tonight. Have a great evening, everybody.
Thank you.
Bye-bye.
Do I just go?
I think it's ending in 5.